The West African Health Organization has flagged off a yellow fever simulation exercise in Lagos. The exercise will test Nigeria's readiness to combat an outbreak. Jokeli Jadu has details.
Representatives of the World Health Organization, the West African Health Organization, the Federal Ministry of Health, World Bank, Lagos State Ministry of Health, Nigeria Center for Disease Control and other relevant emergency agencies gathered in Lagos for the yellow fever simulation exercise, aimed at strengthening the preparedness of response teams and building capacity of health personnel against possible outbreak of yellow fever in Nigeria and neighboring African countries.
Part of the things we're doing with this exercise is to ensure we simulate an outbreak and understand the realities of the practicalities within West Africa in terms of borders, in terms of cultural attitudes, in terms of number of vaccines we have.
We need to enlighten the public. Because as it is now, we have a lot of cultural issues. Some of them that go against the need to vaccinate. And it's our responsibility as government to change those mindsets.
Yellow fever is a viral disease transmitted to humans through the bite of infected mosquitoes. And Nigeria has in recent times witnessed sporadic outbreaks in Kwara, Kano, Niger, Nasarawa, Kebbi, Kogi and Zamfara, leaving other states in the country vulnerable. Convener of the exercise, the West African Health Organization, says the urban and populous nature of Lagos has made it perfect for a simulation exercise like this one.
We know the dynamics of Lagos, and not just the dynamics of Lagos, but the challenges of Lagos. So it's important that we make a start. And remember that in most things that change in life, that things that you prepare, you don't have to do it all at the same time. We use a particular policy called PDSA, plan, we do it, we study what we learned from it, and then we act on what we have done.
If you have an outbreak in Nigeria, the tendency that it can spread to other regions is very high. The impact on the population would also be high because of the large population. So Nigeria is central in Africa, and once you control any impact you have in Nigeria, it reflects on the entire African region.
The exercise will involve training and evaluation of personnel, equipment and logistics needed in the event of an outbreak.
We're going to be testing at the different locations that are necessarily part of a response. So part of it will be with the Lagos State Department of Public Health. The port services there'll be people at the borders, clinical services where patients are provided care, the laboratory services, logistics. So we're going to test communications, social mobilization, all aspects.
The World Health Organization in January 2018 raised the alarm over imminent outbreak of yellow fever in Nigeria, citing concerns about urban areas. Jokeli Jadu, TVC News, Lagos.